shared her experience with uterine fibroids. Fibroids are small, non-cancerous tissue that develop around the uterus, and she's back in studio live with us with symptoms of fibroids and how they can affect your quality of life. Good morning, Ashley.
Hi, Tracy. It's been over a year since my uterine fibroid diagnosis. Recently, I had a 3-hour surgery to remove the fibroids. I was able to speak to my physician about what they are and why they are so common. The symptoms of uterine fibroids vary from person to person. Dr. Megan Billow of the Cleveland Clinic explains what most patients experience.
Fibroids are really common and oftentimes will present with heavy bleeding, typically regular once a month heavy bleeding. They can also present with a lot of pelvic pain and pelvic pressure as well.
Fibroid is a non-cancerous growth made of muscle and tissue that develops in or around the womb during a woman's childbearing years. Symptoms of fibroids are really dependent on the size, number, and location of fibroids.
A lot of patients actually don't have any symptoms, if even with fibroids. And it's not until the fibroids grow, which they do grow over time.
My own uterine fibroid diagnosis started out with 9. When it was time for the myomectomy, the surgical team removed 13.
So a myomectomy surgery is when the fibroids themselves are removed and the patient still retains their uterus and cervix.
A myomectomy does not ensure the fibroids will not return. The only way to guarantee that is for the patient to have a partial hysterectomy or full hysterectomy.
Partial hysterectomy is removal of uterus and cervix. We also, it's standard of care to also remove both of the fallopian tubes at this time, but a patient would keep their ovaries. A full or complete hysterectomy is removal of uterus, cervix, fallopian tubes, and both of the ovaries.
Dr. Billow says there is a limited amount of space inside the torso and pelvic area. Fibroids can push and block other organs.
They can cause really severe symptoms related to bowel and bladder. There's also patients that sometimes will present and they can't go to the bathroom, they can't urinate, and they require a Foley catheter because the bladder, in relation to the uterus and the fibroids, is being blocked.
The growth of fibroids is stimulated by hormones, so a woman's naturally producing hormones are what causes fibroids. According to the University of Michigan, African American women are roughly 3 times more likely to develop fibroids and severe symptoms. If you're experiencing symptoms of uterine fibroids, it's best to consult your primary care physician for a proper diagnosis. Live in the studio, Ashley Bell, Erie News Now.
Thank you, Ashley.